In Semester 1, we offer a course called Sexual, Reproductive and Child Health, a Global Health Perspective. Its course code number is PUBH 7106. I'm Maxine Whittaker and I'm the coordinator of this course, Semester 1, at the School of Public Health. The course addresses very important issues of sexual, reproductive, maternal, neonatal, child health, health of men and women, adolescents around the world, with a special focus on low and middle income countries. The course content ranges from the theory of some of the programs and problems that are facing the world in these areas, but also looks at the practical issues. What works? What are the success stories? How can we learn from others? And by the end of the course, you will have had a lot of practical experience in thinking about how to implement programs to address these very important burdens on people's lives around the world. Every minute of the day around the world, 12 to 13 children under the age of 5 die. But we have had, in the last 15 years, 30 to 40% decrease in child mortality around the world, doing things we know that work. But we need to get more access to these. Every minute of the day around the world, 380 women become pregnant. And every minute, one of those women will die from a pregnancy-related cause. But 75% of these deaths and the morbidities that the survivors suffer are preventable. 99% of those deaths are in the developing world. But we have got success stories around the world, and we'll look at those and share those, see videos about them, look at the tools that are available, work in groups to understand how to do something about these problems. Every minute of the day, 11 people are infected by HIV, and 6 to 7 of these are women. And every minute of the day around the world, there are more than 6,000 people who are new infections of syphilis, gonorrhea, chlamydia or trichomonasis. So these are things we will address. We don't address these from a clinical perspective. You don't need to be a clinician to do this subject, but we will look at a systems approach, a rights-based perspective. We'll understand health systems, how they influence the ability of people to prevent these problems, manage these problems, treat them, prevent death and disability from them. We'll look at how to save neonates' lives with examples from around the world, taking also a social perspective, a systems perspective, and a rights-based perspective. We do lots of practical things in the course, and you'll actually be putting these into practice, these ideas, this critical thinking, with case studies, prompts by videos, and working from each other. People who join the course often have a lot of experience from where they've been working, and we want to learn from that experience. So I welcome you to consider PUBH 7106 as something you might want to do as an elective Semester 1. You're most welcome.